If your boils keep coming back and leave scar, please listen. This could be Hidradenitis Suppurativa. It is also known as Acne Inversa. It is a chronic scarring inflammatory acne-like disease of apocrine sweat gland bearing skin. It is characteristic by recurrent painful abscess, sinus tract formation, bridge scarring, and fibrosis. It is more common in female than male, although anogenital disease is more common in male. Onset is after puberty and it is rarely occur before puberty, so it is peak in reproductive age, and it is strongly associated with obesity and smoking. Causes and risk factor of hidradenitis suppurativa: lifestyle, smoking and poor hygiene; metabolic causes, obesity and diabetes mellitus; hormonal causes such as polycystic ovarian disease, androgen excess, and steroid therapy; genetic causes. It is associated with chromosome 15q24-25. Multiple members of the family may be affected. It can be a part of rare syndrome like PASH or PAPASH. The word PASH indicates pyogenic gangrenosis, acne, suppurative hidradenitis. PAPASH indicate pyogenic gangrenosis, acne, pyogenic arthritis, suppurative hidradenitis. HS may be associated with acne, pyrenoidal sinus, or corn disease. Pathogenesis. It starts with obstruction of duct of apocrine sweat gland by keratin, which causes dilatation of the duct of the gland, which leads to infection. Lesion is usually sterile, but there is any secondary bacterial infection with the Staphylococcus aureus or Propionibacterium acne, the infection which leads into abscess formation in the dermis. After that, there will be involvement of subcutaneous tissue and adjacent apocrine gland, which leads to fibrosis, scarring, sinus formation. Finally, it will be spreading to the surrounding tissue. The site of involvement or the most common site is axilla. Often it is bilateral. Other sites are groin, areola, umbilicus, scalp, chest, perineum, submammary region, nape of the neck, mons pubis, inner thigh, and side of the scrotum as well as perineum and buttocks. Clinical features. There is painful tender nodules are present due to abscess formation. There will be multiple discharging sinus and the discharge is pleural. Induration occurs due to fibrosis. Bridge scarring is present between the lesion. The lesion tend to recur in same location. Where there is perineal involvement, there will be multiple rise to boils, leads to sinus tract formation, bridge scarring, and multiple point of discharges. Rarely it involved in the anal region, which may progress into squamous cell carcinoma. Hurley staging system in hidradenitis suppurativa. It has 3 stages. In stage 1, abscess formation, it may be single or multiple without no sinus tract or scarring. In stage 2, it may be single or multiple recurrent abscess with the sinus tract formation or scarring. In stage 3, diffuse or near diffuse involvement with multiple interconnected sinus tract and abscess across the entire area. Diagnosis. There is no confirmatory test or specific characteristic for diagnosis. Here, hence, the diagnosis is clinical. Differential diagnosis. In the early stage, distinct from furunculosis can be difficult. Tuberculous sinus, Crohn's disease, cryptoglandular fistula, pyrenoidal sinus, actinomycosis, lymphogranuloma verinum, granuloma inguinale, malignancy like squamous cell carcinoma of skin. In investigation, first one is discharge study, culture and sensitivity, AFB smear or culture to rule out TB, biopsy to exclude malignancy or granulomatous disease. Treatment, gentle measures. First one is stop smoking, second one is weight loss, third one is use antiseptic soap, fourth one is maintain good personal hygiene, fifth one is wear loose aerated non-compressive clothes. In medical therapy, oral antibiotics like clindamycin, erythromycin, doxycycline, surgical treatments such as incision and drainage for acute abscess, while excision requires to removal of all apocrine bearing skin in the affected area, skin grafting for closure, and laser therapy. This video is for educational purpose only. Thank you.